Hello everyone. In today's video, I will talk about acute sinusitis, including its signs and symptoms, as well as treatment options. Sinuses become swollen and inflamed when you have acute sinusitis, also known as acute rhinosinusitis. This condition affects the cavities that surround your nasal passages. This prevents drainage from occurring and leads to the accumulation of mucus. The common cold is the most common factor that leads to acute sinusitis. When you have acute sinusitis, it may be challenging for you to breathe through your nose. You might feel like there is swelling in the area around your eyes and face, and you might also have throbbing facial pain or a headache. There are a variety of signs and symptoms. A thick, yellow or greenish discharge that drains down the back of the throat or comes out of the nose. Obstruction or congestion in the nasal passages, which makes it difficult to breathe through the nose. Symptoms including pain, tenderness, swelling, and pressure in the area around your eyes, cheeks, or nose. A diminished capacity for smell and taste, cough, which may be more severe when you wake up, ear pain, headache. You are experiencing discomfort in your upper jaw and teeth, halitosis, also known as bad breath fatigue fever. When to go see a physician? You may be able to treat your sinusitis symptoms on your own if they are mild. Get in touch with your primary care provider if you experience any of the following: presenting symptoms that have not improved after a few days or that have become worse, a persistent fever, a history of sinusitis that is either recurrent or chronic, inflammation of the forehead, extreme pain in the head, disorientation, double vision, or other variations in vision, stiff neck, and shortness of breath are the symptoms. Let's talk about the dangers it poses now, shall we? One of the factors that puts you at risk is having hay fever or another allergic condition that affects your sinuses. A deviation of the nasal septum, nasal polyps, or nasal tumors are all examples of abnormalities that can occur in the nasal passages. A disorder of the immune system, such as immunoglobulin or antibody deficiency, or a medical condition such as cystic fibrosis or gastroesophageal reflux disease, GERD. Now, let's have a quick conversation about how to treat it. Your doctor may recommend treatments to help relieve the symptoms of sinusitis, such as nasal spray, which is used to rinse the nasal passages and is sprayed into the nose multiple times a day. Nasal corticosteroids. These nasal sprays can help prevent inflammation as well as treat it. Beclomethasone, Biconase AQ, fluticasone, Flonase, Montesone, Nasonex, budesonide, Rhinocort Aqua, triamcinolone, Nasacort AQ, and triamcinolone, Rhinocort Aqua, are some examples of these types of medications. Decongestants. These medicines can be purchased without a doctor's prescription or over-the-counter, OTC, and they also come in the form of tablets and nasal sprays. Oral decongestants that are available over-the-counter include Sudift, Actift, and Drixro. Oxymetazoline, also known as Afrin, is found in some nasal sprays. In most cases, the total amount of time spent on these medications does not exceed a few days. In the event that they do not, they may cause a return of more severe congestion, referred to as rebound congestion. Pain relievers that are available without a prescription, such as aspirin, acetaminophen, Tylenol and similar products, or ibuprofen, Advil, Motrin IB and similar products. Because of the association between aspirin and Ray's syndrome, adults should exercise extreme caution when administering aspirin to children or adolescents. Even though it has been determined that children over the age of 2 can safely take aspirin, children and teenagers who are recovering from chickenpox or symptoms similar to the flu, should never take aspirin. If you are concerned, you should consult your physician. I'm going to give you an explanation of the function of antibiotics right now. In most cases, antibiotics are not required in order to treat acute sinusitis. When acute sinusitis is brought on by a viral or fungal infection, antibiotic treatment will not be effective. The vast majority of cases of bacterial sinusitis get better without the use of antibiotics. In most cases, antibiotic treatment is not required unless the infection is severe, continues to occur, or is long-lasting. Antibiotics such as amoxicillin, also known as Amoxil, doxycycline, also known as Dorix, Monodox, and other brands, and the combination drug trimethoprim sulfamethoxazole, also known as Bactrim, Septra, and other brands, are used to treat acute sinusitis that is brought on by bacterial infection. Your physician may prescribe a different antibiotic to treat the infection if it does not clear up on its own or if the sinusitis returns after being treated. That is all I have time for today. I appreciate you taking the time to watch the video.